Well, so let's get started. We'll see who comes in later on. I'm hoping that you guys had some questions that you wanted to kind of ask, and we'll go through some questions and answers.
Okay, sounds good.
So, anything you guys you set the tone for things. What do you want to talk about?
The first thing I wanted to go through is the IC, the Intellicare.
Okay.
But now I can't work on my computer while I'm watching you, correct?
Right, but we can play back this. You can play back this video as soon as it's done. So okay. I'll take you through some steps, and then you can play it back. That way, you can pause it and go through the steps as you need.
Okay. Just if you could do the bite wings one again.
Okay.
Just do bite wings, yeah.
All right. So a couple things with bite wings. Depending on what code you typically use, and I'll start one from scratch. So list Intellicare and new. And I don't know why this red mark is across the screen, and I don't know how to get it off of there either. So let's see.
That's all right.
Annotate. Let's see. Clear all drawings. Okay, there it goes. So go back to my mouse. Okay. Okay, so let's just call this do for bite wing review. And I'm going to start this with services. And I'm going to add the services that basically what we're going to do is we're saying patients are required to have this service every X number of period of time. Otherwise, we're going to get a icon. So we're going to add our D0272. We're going to add our D0274. And then we're also going to add our full series, D0210, because that includes bite wings. All right?
Right.
And we're going to say that patients get bite wings every 12 months or 6 months, whatever you guys do, and then a day.
Okay.
Now, we want to begin warning immediately. So that's at 0 weeks. And then if you want to, you could set it up so only kids over 5 or people over 5 get that warning. And then the last part is to add an icon to it. Hit browse and find an icon. You're not going to have as many icons as what's going to show up on my screen, but the typical icon that I use is the green tooth.
Okay.
Open it. And I wanted to display 2 different places. So I wanted to show on my schedule, on the on schedule, and I wanted to show on my clinical screen.
Okay.
And that's it. That will do it so that the minute the person has completed a 272, a 274, or a 210, the icon will go away for 12 months and a day.
Okay.
Make sense?
Okay. Yes. Now, okay, so I understand that. So I understand how to do that because we don't do FMX here. We just do PANS. Okay.
Then you won't have to worry about adding the FMX to the list. Yep. Now, one of the things I talked about on the site was if you are getting a lot of new patients and they're bringing bite wings, and imagine I had bite wings taken 6-7 months ago, and you're going to accept those, then you might want to create an admin code for bite wings from another office, add that to your list, and as you can see, I've got some admin codes for like an imported full series. That way I know that
and what is it that you use?
What do I use for the imported?
Yeah, what is your admin code for the importing of those?
So I use an A210. So all of my admin codes start with an A. That way I know they're admin codes. So my admin code is an A210, which is a D210. All right. And then my description is almost identical. I always use, and you can see in my descriptions, like everything says evaluation. So alphabetically, they're all grouped together instead of periodic exam and emergency exam. It all says, well, we don't use the word exam anymore, but evaluation periodic, evaluation comprehensive, evaluation problem focus. So they're all grouped together. So I would have imaging imported full mouth. That way on your drop-down list, because Wendy, you were asking about this, on your drop-down list in the quick picks, they're very clearly marked and they're very clearly laid out together, because if you've got porcelain fused to high noble metal and then you've got, you know, all gold crown, alphabetically the all gold crown is going to be first on your list, and it just doesn't work. So
Right.
that's what I do. So here's my description.
So then you have to walk that out, right?
And I walk that out, and when I do walk it out, I change the date of service to the date of service of that FMX that I'm importing.
That was what I was going to ask you. So
Yep.
where's the date of service?
So I'll show you that. So the other thing you want to do here is see how I have allow for freeform description? That allows you to change that description. So you could have imported FMX, you know, change that from Dr. Smith or something like that.
Okay.
Right. And I'll show you how it looks when you walk it out. So that's that. That's your, I'm not going to save this because I already have a Bitewing set up in my system. Then when I walk out that service, my system's going to be slow because we're all connected here, but let's see. When I walk out that service, I hit my A, whoops, forget as a treatment plan, A210. And because this is freeform description, I can write FMX from Dr. Jones. If I could spell, it'd be dangerous. From Dr. Jones, I edit that service, and I change my data service to whatever it was. So it was taken 1/15/2000, 2006. Right. There you go. And that will allow for aging. And now if I have an FMX Intellicare, it will show up 36 months or 60 months or whatever you guys do from the date of that PAN, FMX, whatever you want.
But do you have to, and you don't have to add that admin code?
What do you mean you don't have to add it? Say again.
Okay, so this FMX right here has a code of A0210 instead of D0210. Only
because that way I know, yeah. See, and you see right here, if I did this with a D210, it will get submitted to insurance, or try to get submitted to insurance.
Okay.
So this way I know that this will never go submitted to insurance. I know from my description that it's an imported one. You know, I just know that any of those admin codes, I don't have to worry about they mistakenly getting submitted to insurance or mistakenly have a fee attached to it. Because the other thing is your normal D210 will have a fee attached to it. Even if you zeroed out the fee and somehow or other it got submitted to insurance, based on the fact that things are set up to send standard fee, it will still go to the insurance with that standard fee attached to it, even though you didn't mean to. So.
Okay, so when you set up that Intellicare for the FMX, do you have to add this code?
Yes.
That okay, that's what I was asking. All right.
So let me bring up my Intellicare for the FMX. So do for FMX or PAN. Come on. So in that I have my FMX, I have my imported FMX, my imported PAN, my regular FMX, and my regular PAN. All right, and I have offices that now we're doing cone beams. I would include those codes too. So if they're doing a 3D, same thing. You have to include those too. So you added a PA though. Yeah, I think that's a mistake. I think I was just showing somebody something. I wouldn't typically. Okay. Yeah. All right. Perfect. That's the problem with this database. Okay. I go around messing with things all day long, trying to test things. So, so those are the your basics. Your Bitewing and your FMX are your basic Intellicares. Now, some of these other ones, the things you see with the asterisks, are the ones that are kind of customized. But the ones without, are the easy ones, like missing a medical history form. So if you wanted to, you could set one up based on documentation. It's already been set up, so it's grayed out. But this one is based on documentation. So it's saying if the person is missing the medical history form, either created or updated, every 24 months and a day, immediately begin warning me with this icon that says that they're missing a medical history. Now, I should have that on the schedule, but I just have so many on here that I don't. But normally I would put it on the schedule and on the clinical screen. And that way I'm going to get that icon showing up on my schedule. All right.
Okay. Mm-hmm.
Now, this pre-medicate is unnecessary, but I use this because in Eaglesoft, when you mark the pre-medicate in the patient preferences, you get a pop-up after you've scheduled the patient that they need to be pre-medicated. And you get a pill that shows up on the schedule. But you don't see that any place other than when you save that initial appointment. So I created this so I would see it no matter what. I want to see this at any point to know that this person needs to be pre-medicated. I want to see it in my clinical screen. I want to see it all kinds of different places. So it's sort of belts and suspenders, but it does kind of the same thing. So, but that's a custom Intellicare. And here's another one that's a really easy one, which is no insurance on file.
Mm-hmm.
So based on patient information, again, it's grayed out because this one's already created. So if the person is missing an employer, that means that they have no insurance. And I get this I with a line through it, so no insurance, and having that show up on my schedule. So that's Intellicare's, you really have to think about it's kind of like a negative. You kind of have to think about it. It's the only way that you can tell what's going on. Wendy, did you have a question?
Mm-hmm.
I see a hand symbol up there. That's funny. All right. And then I always do this one, which is overdue for recare. And I set that up so that if a patient hasn't had an adult prophy, a child prophy, or perio maintenance, and again, based on services, just like I did with the bite wings, for 8 months and a day, then I get a toothbrush that shows up on my schedule. And the great thing about that is, you might have a patient who's scheduled every 6 months, but they can't make it. They only take a Wednesday evening or something like that, and they couldn't get in. So they might wind up being 7 months out. So I always do this as 8 months, just so I can tell that the person is really not overdue. This person truly is overdue for recall. So,
right.
and again, the more you play with these, the better off you are.
Okay.
So, all right, Wendy, is your mic? Wait, let me unmute you. Maybe that's why. Unmute. Let's see. It's not. Oh. Wendy, can you hear me?
Yes, I can hear you.
And now I can hear you. There you go. Perfect.
Oh, yay.
Perfect. I'm glad you texted me.
I don't know how to talk. I don't know how to type.
Yeah.
I don't know how to ask questions.
So, yeah, if you think of anything, let me know. Yeah, but this overdue for recall really works well because if you have a patient who is going through restorative care and they got sort of stuck in the mix, you might never know that they were overdue for recall. So that's a quick, easy one you can do. And then I posted this out there before. This patients who have less than $200 left of their max. This is a custom Intellicare. And this is like special coding that has to be done. But what I get is a battery that shows up on my schedule for anybody who has less than, say, $200 of their benefits left for the year, or you could make this $500 or whatever. But some of these are customized based on the office, and it does take a little bit more work. So,
who does that for us?
Either, the only people who really can do it are Patterson Technology Advisors.
Okay.
They have access to the Patterson Technology Center. The Patterson Technology Center will create these on a one-off basis. They'll if you ask and it's they have time to do it, they can create custom Intellicares for you. But what I'll tell you is some of the custom Intellicares will actually slow down your system, because what they do is they'll actually like the minute you open your schedule, it has to kind of comb through the patient's account before it can give you a response back. So some of these things can really slow down your schedule, and I don't recommend them. The ones that I have in my system, I know they've been tested and they work and they're very quick. But like James Russo, who's in the group, and I have been playing around with some of these codes, and they work, but it's not something I'm going to suggest to anybody.
Okay.
Now, Wendy, did you have a question?
Well, for that Intellicare that you created for the pre-medications?
Yes.
that's the custom one, right? Can I get a code? I mean, like the.
Yeah, but the only problem with it giving you the code is it might not work with your system, because each office, like the line items, it's based on an alert, and each alert that you put in the system has like a number code. So it has to be tied to that. So like I said, these are all things that have to be done sort of on site in the office. And you really don't need this if you have the normal patient alert for pre-medication. It's just one that I created for an office that needed it for that
I
time.
do have an alert set up too, but I just wonder if Intellicare is better.
Yeah, I agree. Intellicare's the thing I like most about Intellicare's is they're set up like if this then that. So if a patient has it, then they need it, or the other way around. So I do like those, but they're not always reliable when it comes to the speed of the system. And like I said, if your system slows down, there's nothing worse. And I'll show you in your schedule. Patterson even put a big red warning on the schedule so that everybody would know not to do these things. So if you go into the setup of the schedule and you look right here, it says using Intellicare indicators may impact the overall on-schedule performance. So they kind of warned you right here. If you do a lot of these, you're going to slow down. So be very careful with what you have. And you can see on my schedule how many either Intellicare alerts or just patient alerts that I have show up. But when you're using a 10-minute schedule, it's not too bad. I mean, here's something that's just a half-hour appointment, and this person's got enough alerts on here that I can tell anything that's going on. I even have, because I set up one to show somebody, I've got two for the same thing. So there's a cash patient and there's a cash patient. But somebody who's overdue for recall, I can quickly see. So.
And I noticed on your schedule too, you have everything written out in Word. You don't have the codes.
Yeah, and I'll tell you why I don't have the codes.
Yep. Why?
Because most of the time, like the clinical staff doesn't know the codes. So I figure, why would I even put the codes out there because the clinical staff are the ones that are kind of looking at the schedule for description of what's being done. If you go to any service code, and of course I picked one that's a admin code. Let's do we'll do the FMAX. Okay, so that display abbreviation there is what shows up on your schedule. So whatever you want to put there, it is what's going to show up on your schedule. So I just go and I customize this to make it, exactly what I want it to say, so that I don't need the procedure codes. It's just, to me, it's just cleaner. That is, and Wendy, we were talking about that. That is also what shows up on your quick pick buttons, whatever that display abbreviation is.
So how do you get it so that the D0210 doesn't show up?
Okay, so go back to your schedule, right click, go to current settings and setup, and see how I just have here it says appointment notes. All right, so the notes are going to be the services that are in that notes field. But I could also have, and this is what you probably have if you've got procedure codes showing up. Where are they? I probably passed it. Appointment services, appointment services, which would put the service codes. But if you put the notes, then it'll show up that way. So, but that's just cleaner, and I can put in what I want, like veneers. That's very obvious. Here's my PFMs. If I was doing an all ceram crown, it would be easier. SRPs.
Yeah.
Just easier for me. A couple other things you'll notice on my schedule. Do you see that double arrow? That lets me know that patient has an appointment both in hygiene and in the doctor's chair. So there's Claire there and there's Claire there.
Oh, that's interesting.
And it's just a trick. So I'll show you how you do it. If you open up Claire's hygiene appointment, right here in the prefix field, I just put dashes. Just dash, dash, dash. And anything that's in the prefix field will put arrows or those, less than and greater than symbols around it. So I wound up with that. And I used Eaglesoft before there was a lab tracker. So this is how I do my lab tracking. So this patient, his lab work is out. So in that prefix field, I just write LO or LI, lab out, lab in. So I know that his case is not back yet. So you can use that prefix field for anything. I have offices that will put, balance due. If you imagine you had a patient who was due to bring in money, the worst thing about putting up something in the notes is it could get lost in some of the other things that are written there. But if you put it here, if you say this person's got a $500, or let's just make it an odd number, like $637 that they have to pay as a copayment, well, that's going to show up right there before their name.
Right. Or you could just put like $2 signs.
Exactly. Yeah.
To alert you that they have a balance.
Exactly. So it's so much easier than having it buried in the notes, and especially if it's a dollar, a numeric system, because it could get lost in the phone numbers or whatever. So, and even if you only had a 15-minute appointment for an insert, that's still going to show up first before anything else. So.
Andrew, would you mind to go over that laugh in and out things again? I missed that. Sorry. Okay.
So inside the appointment screen, there's a prefix field.
Oh, okay.
So I just write when I make the appointment, I just write out in that field, and then whoever checks in the cases as they come back in, they just put in the word in. Now, the lab tracker is a great feature, but it requires that somebody creates a secondary lab slip. So this is just, before there was a lab tracker, this is the way I started tracking lab cases in Eaglesoft. So it's just kind of one of those secondary tricks I use when people say, hey, Andre, should I use a lab tracker? I say, well, do you really want to make a secondary lab slip, or do you just want to have a note inside the appointment? And they just talk about the notes. So that's the way I created that. Yep.
Okay.
Let's see. Now, this is an alert that I put on patient's account. So it says VIPF. That lets me know that patient is a financial problem. All right. So if I see a red VIP, I know that they have a financial problem. If I see a yellow VIP, and let's see if I see one on anybody on here. Yep, there's one. So if I see a yellow VIP, that lets me know that patient is somebody who breaks appointments. So that's just a patient alert. So I can't really do much to make that automatically trigger, but those patients who, normally, or offices I've gone in, they have these sort of symbols that say, or alerts that say, ask the patient to come 15 minutes early, or, don't give them evening appointments or whatever. I can automatically tell this person has problems keeping appointments. With the VIPF, I can set that up as an Intellicare, and I can set it up like this: if this, then that. So if a patient has a balance, let's just go back over here. So let's go back to list Intellicare, and I'll just make a whole new one, and not that I'll save it this way, but let's just call this Deadbeats, and I'll say based on the accounts. All right, if the patient has a balance that is over 30 days old, all right, and their balance is more than, say, $200 or whatever you want it to be, all right, and they haven't made a payment in 30 days, all right, then I want a symbol. And like I said, my symbol would be a VIP. They're very important for me, VIP, and I have a red one. And I would put it on my schedules. And that way I can tell automatically. Now, if they make a payment, they'll go away, even though they might have a 31-day-old balance over $200, but at least they're being current. So those are the kind of things that you can set up so that they automatically flag you if somebody is, not being consistent with their payments. So you could have somebody who has a really large balance, but they come in every week and give you a check for $10, and that might be okay for you. So they're not really a deadbeat; they're just slow paying. So that's a good way to put sort of a symbol in there for that.
Right.
And I think I was saying in the last webinar that I haven't come up with, but I have offices that ask for these Intellicares. So I think I may be up to a couple hundred indicators. Now, in your system right now, you probably have about 50 or 100 indicators, but you can see I've got, I don't know how many are in here, but I've got hundreds of indicators in here for Intellicares or for patient alerts. And it could be anything as simplistic as, patient doesn't speak English. And a lot of times if I'll put different flags in here if we have if you're in an area where you've got different languages in an office. But if the patient came in through Living Social or through Groupon, you can have an icon for it. And there's just unlimited amounts of things that you could do. But if it's important to you, you should have it show up. And there was just a discussion about fluoride and how those things show up. So you could have a memo symbol here, or I actually have one that's for fluoride. Let's see if I can find it. Fluoride 1 time a year. Here it is. Fluoride once a year, fluoride twice a year, no fluoride for this patient. So you could make up a symbol for just about anything.
And these are all okay. Well,
yep. And if you need one, if you need something, if you say, hey, I need an icon for X, let me know, and I'll just send you one of these out of here.
Yeah, I would like to put both the VIP yellow icon and the red. If you can send it to me, that'd be great.
Yep. Yeah. What I'll do is I'll put them in the file. So here's my VIPs. So my green VIPs are truly VIPs, like family, good friends, people who you give discounts to, for that kind of stuff. And then I have the red one for financial, the yellow one for appointments. So, and you can use these for wherever you want, but I'll actually put all these in there. All right. Cool.
Okay.
And let me close that out. So yeah, I'll put that.
Do you have
Go ahead. I'm listening.
Go on. Do you have an Intellicare we're finding more and more Delta plans are coming out where the diagnostic and preventative is not going towards their max.
Yeah, I do. I created one, but the problem is oh boy, the meeting's about to, let's see. We're going to get cut off in a couple minutes, but what I do is I put that information into the notes field of the employer plan, and then just create an alert for it. So, but there's really not a way that you can do an Intellicare for it because there's nothing that would trigger.
Okay. Okay, so that would be an alert. Yep.
Yep. Yeah. And the biggest thing now is you just have to make sure that when you're setting up these plans, you've got to really just tweak the benefits page so that it shows. But you guys know that when your clinical team is in their chart, they can see the notes from the employer screen, right? Did you know that?
I did not know that.
Okay, so when they're in the chart and they hit this insurance button, all the notes that you put in the employer notes field show up here. So you see how I have it kind of as sort of shorthand, 2 prophies per year, no adult fluoride, composite, downgraded, no implant coverage. So that information comes right from that employer screen. Let me go over here to list. Oops, I can't do it from here. List, employers.
So then that would keep the hygienist from coming out and always asking.
Exactly.
If they looked at that.
Yep. If you put it in this field, it's automatically going to show up there. And like I said, I do a shorthand for the things that are the most important. No adult fluoride, 2 prophies per year, no cover, no deductible applies to this or whatever. Whatever's important to you, it should go into this field.
Right.
Yep.
Okay.
And you have to always type it in there. There's no way to do like an autofill or anything like that. So a lot of people will even do like a Word document on the desktop, fill it out and then copy and paste it into that field. But that way, like you said, if hygiene's looking for information, they hit the insurance button. It should be right there. Here's all my breakdown of coverage. All right. And the beauty of this is they can't change anything. They can only view it. So they're not going into an employer field where they might, change something or whatever.
Right.
Or they might
What
not
do you
even
put
have
for
access to it.
posterior? What do you put for posterior residence not covered?
I put,
You just put it in the
see,
notes?
I put composite down, posterior composites downgraded. If there's no
Okay,
coverage,
yeah,
then it
we
would
do.
be here, because I actually have a second, you'll see here, I have a restorative post-resin service type. And if there was no coverage for post-resins at all, this would be a 0.
Okay.
Yep. So if they,
Did you
like if an insurance
can you
company
add
denied
to
it,
that?
yeah,
Mm-hmm.
my list, and it's on the, should be on the group, but let me open this back up. List, general setup, and then service types. I break out almost every single service type into categories where something is split off. So I don't know if you know this, but in the next year, you're going to see where single crowns are covered at one rate, and then multiple crowns, like a bridge, is covered at another rate.
Oh,
So I've already
that's
taken care of
interesting.
that by saying, here's my fixed prosto single units, fixed prosto multi-units. So imagine they cover single units at 80%, they cover bridges at 50%. I've already got it preset. My dentures, but the adjustment and repairs covered at one rate, and then the actual dentures themselves covered at a different rate.
Yeah, I didn't know you could add to that.
Sure, just go in and hit new, and again, just try to keep consistent with the way that you're writing it. So prosto, fix, prosto, fix, prosto,
Right.
Yep, and then like orthodontic adult. So I tag my Invisalign cases to this, and then my ortho child here, because maybe they have coverage for over 18, so I could change my rate to 50% for a particular plan.
Mm-hmm.
And then my implant body, and then my implant restorations, and then diagnostic non-covered service. So working films during a root canal, or something like that. There's lots of things that you can think about these categories where or even like a preventive non-covered. So adult fluoride is a preventive service, but it's not covered.
Right.
So I split out these as far as I can.
What about perio maintenance? Where would you put that?
You could have a separate perio maintenance category. So you could have perio services or perio surgery, so actual services, and then perio maintenance as a second line item.
Right.
Yep.
Okay.
Or you can actually, if perio maintenance is covered under preventive, you could do it that way too. So whatever you want, you can make as many categories as you like. And I think about if you had a sheet that you called into insurance with, you could do it that way so that you could make as many categories as you want, so that when you call the insurance company and you have these categories, they're filling them in as you go. I mean, do you ask about night guards? Do you ask about whatever? You can make a category for it. So that when you're building an employer and you're going down your employer list, you can actually have a category to put in with a deductible if it's covered or not. And then the defaults, like my restorative post-resin defaults to 35%. It's just the math that I've worked out, knowing that they cover 80% of amalgams. So that automatically does my downgrade without having to do any. That's why you guys keep saying to me, I don't ever do coverage books, because my math is pretty close. And if it's not close enough, I'll just go in and take I'll take an EOB and do the math and say, well, they paid $35 out of $100. That's 35%. Or they paid $32. That's 32%. So you can do the math and be able to make yourself a category to get close. If you want it dead on, then you can add your coverage books for those four codes. So
very interesting.
Any other questions? Because we've got 10 minutes, and then this thing is going to shut, or actually 5 minutes, and then this this session is going to cut off.
So today's our last day. Oh, go ahead.
No, go ahead. It's your session.
Well, and everybody's unmuted, so anybody who has a question can ask.
So I'm going to run end of day today, and I'm going to run end of month, and then I'm going to back up, and then I'm going to come in early next week and do end of year.
Okay.
What do you think about? Is that?
That's fine. Just make sure that when you do your end of day, your end of year, and you do it next week, make sure you change the date at the top of the screen, because it's going to look like you did your end of year of 2018, because it's going to pull the date. Yep. Or when you log out of Eaglesoft when you log back into Eaglesoft for the day, change your date to December 31st, log in.
Oh, I'm so glad you told me that.
Yep.
All
Yeah,
right.
anytime you kind of are backdating things, when you turn your Eaglesoft on in the morning, just change your date to the date you want it to show up in your reports, then log in.
Right. All right, I will do that. Thanks for that.
Sure thing.